Stop! 9 supplements. Seniors shouldn't take without doctor approval. Always check with your doctor before starting any supplement, stopping any supplement. I can't stress this enough. While the supplement aisle at your local pharmacy might seem like a shortcut to better health, it's not always that simple, especially for seniors. Today, we're going to talk about 9 supplements seniors should avoid without getting direct medical approval first. We're going to spend about 10 minutes together on this YouTube video, and I promise it's time well spent. Why? Because what you don't know can hurt you. Many people assume that because something is labeled natural, it's automatically safe. That's a dangerous myth. Some natural pills can be incredibly dangerous when combined with common medications that many seniors rely on daily. These interactions can make your prescriptions less effective or worse, cause severe side effects. The supplement industry is largely unregulated, which means the claims on the bottle don't always match reality or how it will affect your unique body and health profile. It's not about scaring you. It's about empowering you with the knowledge to make safe, informed decisions about your health. So, grab a notepad, because you'll want to remember these. We're going to break down each supplement, explain the risks, and why a conversation with your healthcare provider is non-negotiable. Let's get into it. First on our list is St. John's Wort. This herbal supplement has gained popularity, often marketed as a natural mood booster for mild depression or anxiety. While there is some research to support its use, it comes with a huge, flashing red warning sign, especially for seniors. The primary danger is its powerful ability to interfere with a massive range of prescription medications by inducing the cytochrome P450 system. Think of this system as your body's drug processing factory. St. John's Wort revs the line, clearing other drugs faster. Medication levels can drop below effective ranges. It can essentially cancel out your prescriptions behind the scenes. The list of affected medications is extensive. Blood thinners like warfarin. If levels drop, risk of clots, stroke, or heart attack goes up. It also interacts with statins. Cardiovascular risk can increase. Common antidepressants can be rendered less effective. Certain blood pressure meds, transplant drugs, even some cancer treatments. Combined with SSRIs, it can cause serotonin syndrome, agitation, confusion, rapid heart rate, high blood pressure, even seizures. This is a medical emergency. Given complex medication regimens, self-prescribing is too risky. Your pharmacist is an incredible resource for spotting interactions. Never assume it's safe. Always check first. This isn't one to play around with. Next up is Ginkgo biloba. Marketed for memory and cognitive support, evidence is mixed, but risks are clearer. It inhibits platelet aggregation, acting like a mild blood thinner. Combined with anticoagulants, bleeding risk can become dangerous. Severe nosebleeds, bruising, GI bleeding, or hemorrhagic stroke. Stop Ginkgo before surgery or dental procedures per surgeon guidance. It may interact with seizure medications, lowering the seizure threshold. Ginkgo should only be taken after explicit doctor approval. Let's talk about garlic. High-dose supplements are not the same as food. Compounds like allicin have antiplatelet effects, bleeding risk. With blood thinners, garlic can throw clotting off and require monitoring. It can also lower blood pressure. Combined with BP meds, risk of hypotension, dizziness, lightheadedness, fainting, higher fall risk. If you're on anticoagulants or BP meds, consult your doctor first. Preparing for surgery, stop well in advance as advised. Enjoy garlic in food, be extremely cautious with pills. These supplements have powerful biological effects that need medical oversight. Vitamin E is essential, an antioxidant that protects cells. Found safely in foods. High-dose supplements, 400 IU day or more, are linked to increased all-cause mortality. Vitamin E thins blood and can inhibit vitamin K, raising bleeding risk. Combined with anticoagulants, risk of hemorrhagic stroke goes up. Not recommended for routine heart disease prevention. Diet sources and low-dose multis are generally fine. Avoid high-dose E unless prescribed. Kava, marketed for relaxation. Serious liver damage reported worldwide, including hepatitis, cirrhosis, even liver failure. Older adults have less efficient liver clearance. Risk is higher. Risk increases with alcohol or pre-existing liver issues. Kava is a CNS depressant, combining with benzos, sleep pills, barbiturates, or antihistamines can cause excessive sedation and falls. If ever considered, it requires strict physician supervision and liver monitoring. A temporary calming effect is not worth irreversible liver failure. Seek safer, regulated options with your doctor. Up next, stimulants in disguise and statins you didn't know you were taking. Yohimbe, sold for weight loss and erectile dysfunction. A potent stimulant can cause rapid heart rate, palpitations, and blood pressure spikes. For seniors with hypertension, coronary disease, or arrhythmias, extremely risky. May trigger heart attack, hypertensive crisis, or dangerous arrhythmias. Psychiatric side effects include anxiety, agitation, and insomnia. Interacts with blood pressure meds, antidepressants, MAOs, SSRIs, ADHD stimulants, and decongestants, risking serotonin syndrome or hypertensive crisis. Labels are inconsistent. Doses vary widely. Seniors should not take Yohimbe without explicit doctor approval. Red yeast rice contains monocolin K, chemically identical to lovastatin. Potency varies dramatically, impossible to dose safely, carries statin-like risks, myopathy and rare rhabdomyolysis, liver toxicity. If you already take a statin, adding red yeast rice may unknowingly double therapy. Treat it like a prescription, physician oversight and blood tests required. Iron is vital, but excess accumulates. Your body can't easily eliminate it. Overload, hemochromatosis, can damage liver, heart, and pancreas. Never take iron without labs, CBC and ferritin guide treatment. Iron can block absorption of key medications. High-dose preformed vitamin A can build up and become toxic. Risks include liver damage and reduced bone density with fracture risk. Natural does not equal safe.